Hi everyone, it's Dr. Behbahani. I'm a general dentist with emphasis on dental implants and dental surgery. And today I'm going to talk to you about 5 important questions you want to ask your surgeon or your dentist before you get your dental implants. Number 1 is the CT scan machine, a cone beam 3D x-ray of your jaw. It's important that you have a chance to sit down and review the findings on a CT scan with your doctor to exactly plan where your implant is going to be placed and how your surgery is going to be done. In our office, we not only use 3D cone beam for every single patient, but we also use digital dentistry to be able to really map out exactly how we're going to perform our surgery beforehand, knowing where the crown is going to be positioned and how big or small the crown is going to be. So when we have these scans, that shows exactly how the bite is on a patient and where the position of the teeth are with respect to each other. And we're able to exactly assess the distance, the heaviness of the bite, and often be able to look at the angulation of where the implant's going to be with respect to the tooth, so that way we have the proper position of the teeth. So it is really, really important to merge these two technologies together from a surgical perspective to the restorative perspective, and be able to know ahead of the time where the tooth is going to be. Because once you place the implant, you cannot move the position of that implant, and now it's in a fixed position, and then we have to sometimes struggle to make the crown that it's going to look lopsided, or it's gonna be crooked, or it's gonna be in a different dimension than we want to. So it's good to actually design the tooth and design the crown in advance and correlate that before we get the surgery with your 3D cone beam scan. Number 2, you want to ask some technical surgical questions. For example, if you don't have enough bone, what are the options? How are we going to build bone and create bone? And besides from bone, we often forget about tissue and the gum, and how much of that thick, resilient, protective tissue we have over the bone or around the implant. So we often have plenty of bone, but we don't have that resilient tissue where we need to have tissue transplant or tissue grafting or gum grafting. So finding out if there is not enough bone, what are the techniques that are going to be done to regenerate and rebuild your bone, also regenerate and rebuild your tissue for an optimum result. Number 3, when we pull a tooth, it is really important to ask your dentist, are we going to get that implant immediately done, or are we going to have a waiting period? It's often the normal practice is to take a tooth out and give it some time to heal, and during that healing time we sometimes get some collapse of a bone and bone loss and bone shrinkage or gum shrinkage, and it happens every time we perform a surgery. So one of the best approach in my practice has been at the time when we take the tooth out and the body is ready to receive an implant, is to place an implant in that socket and graft it, and sometimes even place a tooth immediately on that implant to mimic the biology of the original tooth, what body knows the best. So it is more technique sensitive. We utilize also 3D technology to build that 3D printed tooth. But it's really important to ask your doctor, minimize the healing time. Instead of taking a tooth out and waiting 4 to 6 months and then go back and place an implant, wait another 4 to 6 months. Now you're talking 8 to 12 months before you get your final restoration, and you may have to deal with a flipper or a plastic tooth, especially if it's in an aesthetic area. You don't want to be without a tooth. So an ideal approach is if you're healthy, if your bone is good, to perform the surgery at the same time. Take the tooth out, place the implant, place the grafting material, scan the implant, and be able to also fabricate a crown and give you that crown. And then 4 months later, you get that permanent tooth on that area. But at least during that time, you are not going to be without a tooth, and your healing is much, much better and easier. Number 4, ask your doctor or your surgeon if they use regenerative factors and biologics. For example, in our practice, we draw patients' blood and we centrifuge that, and we use their PRP, which is called platelet-rich plasma, as healing factors. Your own blood has the most amount of healing factors in there. So if you're able to extract these proteins and these growth factors and put them back in a surgical site, you're going to heal so much faster. So this is a question you could ask your dentist. If they're using any sort of additional biologics or regenerative material, there's some synthetic materials out there. In our practice, as I said, we use patients' own blood because that gives us phenomenal result, and also faster healing, less post-op pain for patients, and essentially less medications that they need to take. So it's really, really important to ask these questions as well. And last but not least, question number 5. You want to ask your doctor, how do they deal with complications? It is not uncommon to sometimes see things, unexpected things happen after the surgery when you perform the surgery perfectly fine, but something goes wrong. That also relates to if a patient is diabetic, or if they have some other systemic disease, or if their healing is slower. There's a lot of factors that could compromise the success of dental implants or any dental surgeries, and we want to minimize those. So it always is astonishing to me that patients are able to sometimes go abroad or go to a different country and get their dental implant or any surgeries done, because one of the biggest issues that we stumble upon is post-op complications, and we want to be able to address those. Your surgeon needs to be available immediately to address those, whether it is a suture that is loosening up or whether it is that you have developed a secondary infection in that site. We want to be able to get in there and address those issues as soon as possible. So, talking to your doctor if you have uncontrolled blood pressure or diabetes or things that could affect and compromise the implant, we want to be ahead of the game and be able to address these issues. So it is really important to ask your dentist or your surgeon, how do they deal with dental complications? I hope you find this video of a good value, and I wish you a very, very good luck on your next journey to get your dental implant. If you have any questions, you're always more than welcome to give our office a call and use us as a second opinion for your treatments. And until next time, thank you very much. I'm Dr. Behbahani.